Good afternoon, everybody, and welcome to our webinar today, the Digital Health Toolbox, Work Smarter, Not Harder. My name is Jenny Pearson. I'm an Education Officer for the Primary Health Network. Before we go any further, I'd like to acknowledge the traditional custodians of the lands we walk, reside and work upon. We pay our respects to First Nations people and value the continued connection to culture, country, waterways, and contributions made to the life of our vast region. I am coming to you from Enewan land in the Northern Tablelands, and luckily it's a little bit warmer today after our 6-degree day yesterday in Armidale. Our presenter today is Sarah Houlihan. Sarah is a Primary Care Improvement Officer with the Primary Health Network. There will be an evaluation that will pop up immediately after the webinar, and we ask that you take a minute to fill it in. You will get a certificate emailed out to you immediately afterwards as well. If you have any questions, please type them into the question box and we'll endeavour to answer them all at the end of Sarah's presentation. All right, I think that's all that you need to hear from me. Thanks, Sarah.
Thanks, Jenny. So thank you everyone for joining us today. I really appreciate the variety of registrations that we receive, not just from general practice, but our allied health friends and some representatives from the local health district, community nursing, aged care. I'm glad this is a topic that has piqued your interest. So thanks, Jenny. Before we get too far into it, I wanted to introduce you to the Healthy Together Digital Care Toolbox. This is located on the PHN website under Health Professionals and then Digital Health. And in here you will find information and links for further information around all of the different digital health initiatives that PHN support, which of course is much wider than just the few topics that we will discuss today. So today we're going to have a closer look at some of the Digital Health Agency's national digital health initiatives and discuss how these can help your team to work smarter. So obviously we want to identify common initiatives that are already available to you and discuss some ways to implement these into your workflows so that we can help you to work smarter, not harder. Thanks, Jen. And the next one. I've chosen to start today with my health record because in my opinion, this is one of the most underrated tools that we have at our disposal, purely because we just don't know what we don't know. So dispel any myths. The vast majority of Australians do have a My Health record. In fact, 23.8 million people have My Health records. And this includes about 330,000 people who had originally opted out or cancelled their My Health record and chose to opt back in. So, where are we? The My Health record is underpinned by legislation and privacy and security measures to protect the owners and users of the record, and all access is able to be tracked and viewed by the record owner. So looking up your neighbour's record out of interest could end up winding you in a lot of trouble, but if you are a health professional working in a registered health care organisation who is actively caring for the patient, then you are able to access the My Health records to benefit the care that you're providing. So you see on the screen here a list of all the different documents that may be contained within a My Health record, but I particularly would like to draw your attention to the ones on the right hand side, the Medicare information, because this is what you will find in almost every My Health record, regardless of anything else that might have been uploaded, like shared health summaries and discharge summaries and whatnot. So this is things like your PBS, AIR, MBS, My Medicare registration, and the organ donor register. And no matter which area of health you work in, GP, allied health, hospital, aged care, specialist rooms, if you can only take one thing away from today, please let it be this. My health record viewing can help give you an incredibly useful insight into patients' health and care needs, save you a whole lot of time running around because the information is in the one place. So with those Medicare things that we talked about, the PBS, the MBS, whatnot, you can look those up via other means, through Proton and whatnot. But this is where working smarter, not harder comes in. Thanks, Jen. So here we've got the Medicare overview. And so yourselves, if you go into the MBS items checker, it's just going to tell you if the patient is eligible or ineligible for a particular service. Whereas in the My Health record, it shows you when and where item numbers were billed. So that, say if you've got a new patient, you can set reminders for when things might be due again. And you've got an easy reference as to which provider rendered the service. If you needed to contact them with any queries, say for a copy of a care plan or results from something that isn't within their My Health record. A really common one, of course, for GP nurses, Aboriginal health practitioners and GPs, is that they're able to see in here when MBS items like health assessments, like care plan reviews have been done, the date of them, to help you to calculate when they'll next be eligible for that service. And certainly when you're looking at things like say you're completing a diabetes cycle of care, being able to see on there when the patient saw the optometrist or the ophthalmologist, the endocrinologist, when they were at the podiatrist for their foot checks, all of this information helps you to be more efficient rather than the patient saying, oh yeah, I think I saw them back in whatever month. You've got that information there at your fingertips to be able to discuss with them. Thanks, Jen. So John has recently moved to town and he's connected with the GP at the local Aboriginal Medical Service, and he requests that this will be his regular GP going forward. He hasn't had a regular doctor for a while. He's been moving around a bit, but recently he had a hospital stay. Afterwards, he followed up with a heart doctor, and the doctor had asked him to change his medications. He wasn't really sure which one he was meant to take, which one he was meant to stop. So he just stopped taking both. And I know this is a pretty familiar scenario that we all encounter within practice, whether it be general practice or a specialist. So My Health record here, you can see, is a fantastic way for the team to be able to work smarter, because they can view the discharge summary from the hospital stay, pathology results from the hospital. Even though you're not listed as the usual GP, though that information is there and able to be viewed. The medicine view allows the GP to see which medications have been prescribed in the past. And then in the Medicare view, obviously, he'll see the MBS billing for the cardiologist telling us the name of the cardiologist, the date of the service, to make it quicker and easier for the GP to be able to make contact. We can also see in the Medicare overview, John had a 715 11 months ago. There's no record of him having had a care plan. So this also then helps being able to see that he's eligible now for a health assessment to look at his bigger picture, and perhaps he might benefit from a GP management plan, team care arrangement, given that there's obviously some history there around his heart. So the My Health app is an agency-owned and managed, it's a consumer app, which is essentially just being able to view your My Health record on your phone or on a mobile device. It was developed by the agency to be able to help consumers and their carers engage with and be proactive in managing their health. Thanks, Jen. So the reason I've included it in terms of working smarter, not harder, when patients have got access to the My Health Record information, obviously if they are visiting, say, outreach clinics, or if they've got home care providers coming in, community nurses, paramedics, there's lots of services who may not have access to My Health Record at the point of care. So the patient having that available, if they choose to share it with that health or care provider, provides that prompt access to key health information, whether it be an emergency or ongoing care. It is secure, safer, allows for faster and more efficient care. And it also, having access to that information for patients and their carers, provides a more informed self-management of health conditions. So we'll have a look at Lisa. So Lisa has notified her GP. She's soon setting off for a working holiday around Australia. Lisa's got a couple of minor health issues, but is generally well managed, and she utilises Allied Health under private health insurance, and lets her GP know that she'll continue to access that while she's away. The GP has chosen to upload a shared health summary so that Lisa's got the most updated list of medications, allergies, medical history, and immunisations. And they suggest to Lisa to download the My Health app onto her phone so that she's got that available with her wherever she is in Australia. And that way she can choose to share her medication history, immunisations, pathology, radiology, discharge summaries, and that shared health summary with any doctor, hospital, allied health or care provider that she might encounter along her travels. In this instance where she's travelling, she might request that event summaries are uploaded if there were any care events that occurred while she's away. And generally encouraging patients to utilise My Health app is a way that of working smarter for us as health professionals, as it removes the need to print and send copies of reports and results. So it reduces that need for providers to disturb the regular GP requesting copies of things and medication history and all that sort of thing. So electronic prescriptions and active script list. So e-prescriptions are particularly helpful with telehealth consultations, of course, but there's no reason why we can't be moving towards e-prescribing for all patients who are willing to receive them. Thanks, Jen. E-prescriptions are a way of working smarter as they maintain your patient privacy, reduce the risk of lost prescriptions, reduce the admin burden, and there's no cost to the practice when you're using ERX as your prescription delivery service. It's possible that if your providers are working with residential aged care homes, the servicing pharmacy may be happy to receive tokens or just directly to the pharmacy, or they may have active script lists set up. So speaking of active script list, so the important difference, I guess, to remember with your electronic prescriptions versus paper prescriptions, the electronic token, so that's the thing that looks like the QR code, is not the prescription itself. It's just a key to unlock the prescription from the delivery service, which for most of us is going to be ERX. And this is why the token can be forwarded by SMS or email from the patient to somebody else to get filled, but yet they can't send a photo of, say, a paper script to be filled. It's why patients can use pharmacy software with their electronic tokens to request home delivery and not have to provide a hard copy. And why prescribers sending electronic tokens or a printed copy of the token to the pharmacy doesn't require you to retain a hard copy of that. So besides being a smarter way to work, e-prescriptions provide obviously safety mechanisms, because the token can be made unavailable if that medication has been ceased or cancelled. And this, of course, is much better for our patients as well, because we're reducing those medication errors. Active Script List is a token management solution. So where our ERX is token delivery or medication script delivery, the Active Script List is basically a storage for the tokens and electronic prescriptions. So it can be used for as little or as many medications that the patient is prescribed. And we're starting to see functionality for Active Script List registration coming into some practice software. But if you haven't got this available to you yet, pharmacies, almost all pharmacies do have this available and can register the patients. So to register, patients provide ID and a consent and access request is sent to them via SMS or email. They acknowledge and respond after checking the terms and conditions, of course. And if patients want to, they can nominate a carer or a family member or agent to be able to manage their Active Script List on their behalf. So the patient only ever has to register once for the Active Script List. And once they've got that script list active, they can go to almost any pharmacy and will just be asked to provide authorization for that pharmacy to dispense their prescriptions. And that just comes via a text message or an email that says, well, like what it says on the screen there, do you authorize this facility to access your Active Script List? So you can see, I'm sure you're all ticking over going, oh my gosh, these patients that constantly lose their scripts cannot lose a script that is in the Active Script List. It certainly is something that is very useful for people who are taking multiple medications. But as I say, there is no minimum number of scripts for whom it may be useful. So, at Maria's recent visit, the GP is suggesting to moving towards e-prescriptions because Maria is taking lots of medications, so she's at high risk of experiencing an adverse medication event, especially if there's any changes to her medicines or the dosage. Maria says she's not really confident managing the digital tokens. She only really uses her smartphone for text messages and FaceTime, but she is happy for them to be sent to her son. That's easy done. So the GP obviously enters in the son's phone number as where the tokens will be sent, but she also encourages Maria to register for the Active Script List at the pharmacy. And then that way Maria can get her scripts filled at any of the pharmacies like we just talked about. So obviously, besides the benefits around safety and convenience for Maria in having a centralised medication list that can be viewed at any chemist, the GP is working smarter instead of harder, as they can now prescribe new medications and cancel old medications without needing to print anything. This obviously saves the practice money on ink and reception time with the sending and storing and shredding and everything else that is involved in those. Just need another copy of the script, please. Thanks, Jen. And we'll go to the next one. So telehealth has been a huge game changer, hasn't it? I know it is not everyone's favourite digital health tool. Bear with me, because we know that telehealth really does improve access to care for so many patients where travel, expense or time away from home is a barrier for them. Having access to telehealth widely certainly has improved access to care for people with disabilities, for frail aged, for people in remote areas. So we can't deny that there are certainly a lot of benefits to utilising telehealth. The complaint, I guess, I hear most from practices is around managing the billing and managing for those who are bulk billing their telehealth consults, concerns around how to manage getting those forms signed to meet the MBS requirements. So the good thing is that the government has sort of backed up their support certainly for video telehealth, by funding the Health Direct video platform for GPs and for allied health. And that now has the feature available where you can have the form signed, the DB4 form, signed within the consult, which is fantastic. So with telehealth, do keep an open mind about it, please, because it is making a difference for our patients, even just people who are commuting who can't make it into your service within normal business hours. But obviously, working smarter rather than harder might mean things like scheduling telehealth appointments, say in blocks at set times a day, so that we're not getting those calls going, oh, the doctor still hasn't called me yet. I know this happens. Have worked in the practice, so I get it. And having that coordinated process for billing as well. Thanks, Jen. So Darren lives on a remote property, and the time it takes him to travel to the GP is just not feasible to do regularly. Obviously, he's got lots of demands of his farm and his family. And his access to care is greatly improved by being able to use telehealth with his GP, with the practice nurse, his specialist, and with allied health providers. Darren's GP works smarter by utilising video telehealth so that they can physically see how he's looking, but also using the video telehealth items means that that Darren can still access things like chronic disease care planning and mental health treatment plans and reviews because they're doing that via video telehealth. The practice nurse can do those support and monitoring visits in between the formal reviews, either via phone or video, depending what's most clinically appropriate. The specialist is providing telehealth consults because they're located a long, long way. And the allied health providers are able to provide that telehealth for Darren as well. So the GP practice, the allied health practice, whatnot, they are working smarter by offering things like online bookings to reduce their admin burden. And they're using the government-funded Health Direct platform for video calling so that it has streamlined their process for meeting MBS requirements. Thanks, Jen. So secure messaging and e-referrals have combined mainly because they're the same but different in that they're all based on the idea of a secure encrypted message direct from provider to provider. So in our region, our main secure messaging providers are around, we're talking about HealthLink, Medical Objects, previously Argus, which of course now has been obtained by HealthLink, and ReferralNet is another one. When we're talking e-referrals, in the Hunter New England region, we've got the Centre e-referrals, and the Central Coast most recently has just introduced 4 services now that have electronic referrals available via HealthLink smart forms. Now, utilising secure messaging, besides obviously being much safer, is much more efficient for the GP and for the practice because you're getting those digital receipts back. You're not having to have admin phoning and seeing the progress of referrals, were they received, where are they at, how have they been triaged, and certainly we know that the HealthLink for sure is being used around the driver's license medicals, My Aged Care referrals, Hearing Australia referrals, and even some workers' comp now is on HealthLink. And it's all designed to be able to get that streamlined approach while securely transferring patient information. Thanks, Jen. We might skip down to 25, please. Perfect, thank you. Now, I won't go too much into Provider Connect because we have a whole session dedicated to it coming up in just 2 weeks. And I would really encourage you to register for that one. Mainly because, but I needed to include it today because Provider Connect really is going to be our work smarter, not harder going into the future. Like a lot of programs, my health record was the same. It's something that's going to grow over time. But the general premise of Provider Connect is that it will be your one-stop shop for updating organisations around changes, say with your workforce, when you've got new registrars, when someone retires, if you move your service location. And by using Provider Connect, you update it in one spot and that is informed to everyone. So please do join us on the 18th of June where we will have the Provider Connect information session for you. Thanks, Jen. Now, if you would like to learn anything more about what we've talked about today, you can see here the screenshot of all the different sections within the Digital Health Agency training modules so that you can find relevant training and software simulators for your role. So I'd encourage you to check that out. And then finally, if you do require any information or support around digital health initiatives, the ones that I've mentioned today or any others, we've got so many different ways to be able to contact the Digital Health Agency, and they're all listed there for you. So Jen, just quickly, do we have any questions that need to be answered today?
No questions have come through yet. We will have a copy of the slides and the recording of this webinar up on the PHN website in the education calendar. Not in the education calendar, in the education library.
Yeah. Thank you everyone for joining us today. Sorry, I didn't really sort of finish up there, but yeah, look, I hope you've learned something new today. If you do have any questions, reach out to your PHN support person, whether that be obviously a primary care improvement officer, to the allied health team, the aged care team, and we can certainly help you with anything that you would like to know around these topics.
There's just been one question come through. Is there a link to register for the 18th of June event? We did send it out today, but Cara, I will reply to your request and send you the link. Thanks everybody for coming, and I'll see you next time.
Thank you. Thanks, Jen.